This is really the implementation of antibiotic regulations, other strategies. You know, in China, we always have to work on the policy part because it's such a big country. Policy is the most effective way to do things. That's the assumption. So I'm trying to short. Xiaoyun told me I should, cut down the whole slide. It's going to take too much time and focusing on few things. Basically, the situation we have done, a nationwide survey has shown, the abuse. It's a very large survey. I found 53% of our patients have described antibiotics, but only half of them, prescribed or properly. 78% of inpatients received therapies, but only a quarter of them they used properly. So this is all the large national surveys. And they did surveillance. It's multiple different kinds of antibiotics. It's combination. And also especially the injection with antibiotics. That's a very common practice in community clinics, in rural clinics. So this is very, they found, the multiple use is 55%. And the quite a severe situation in most of the 3 times higher than other developing countries. So this is a very serious issue in China, the antibiotic abuse. And the resistance. This is the rising trend of AMR resistance found in this. We have AMR surveillance in China. This was established by the government. They included many, many hospitals. So the trend is very significant by Ministry of Health. They started 2005, and then they followed each year. They have issued different report. You can see the trend of the resistance. I'm going to go over. This is lots of policies, not lots of policies, but the first policy of 2004, and they reinforce it by different government agencies. But it's very limited effect. All the literature show quite a lot of writing on this field. It's nothing changed for people's behavior, for doctors' behavior, institutional behavior. That means you issue a policy, we don't have anything. So now we want to see if we can take a look at this, whether or not we do from a system perspective, we can look at this as supplier demand regulations on different system. Complexity comes here is if it's a linear model, that means government make policy, they will obey the regulation, and the patient will be well aware of the consequences. That's not linear. For the government, they are making policies, and at the same time they implement the policies. And now, especially most of the antibiotics used prescribed by the health facilities owned by them. So they have to ensure the income of the health staff, and also ensure the hospitals won't bankrupt. On the one hand, so the motivation for the government is is really in conflict with the abuse. Almost 62% of national total expenditure occurred in the health facilities. That means most of the drugs sold there is the majority, the provider. And the clinics are owned by the government. The other thing, drug producers, they are not only for wholesales, but they have a retail pharmacies. It's very direct selling to the patients. And the trend is increasing now, accounting for 30%. Health facilities and the retailers combined is about 90%. There are some informal barefoot doctors and other people, they also gave a prescription. The patient it's kind of like they want to get the drugs. They feel if they don't take it, that means they are not treated. This is the perception, like Jared talked about. You can see you have all these people, almost all the players in the system. The incentive structure is to use it, so that this is something why the regulation didn't work. because they never be able to change the incentives. So then we think about, they have conflict, for the government that has conflicting objectives, maintaining the operation and income of public health facilities and supervising these activities to meet people's interest. So they have to sure they get people want these drugs, especially with essential drug list. Why it failed the whole reform is people want those drugs, you have to give them. That's your healthcare reform's goal. Satisfy people's need and also make sure the hospitals will operating. So this is one of the challenges. This kind of arrangement has preserved incentive for overprescription. And also the policy is a 15% markup policy. Means you sell the drug, you can add the price, and the people turn out they want to buy expensive drugs, so they can add more, 15% of $1 versus 15% of $100. So they always go to the higher price. Even you lower the price, they don't like it. So in terms of whole facility operation, the 66% of the drugs sold is operating on this kind of a policy for management. It's not going to work. So the other sort of this is something they have so many times trying to give different, more than 30 times of the government trying to reduce the price, all failed. We have another new policy 2 weeks ago. We will Healthcare Reform Commission on the top leaders just issued. I don't. The reporters interviewed me asking my opinion. I said, no matter which way, it's not going to work. We have no solutions. So the doctors, good drugs and quality of service, that's their perform. The more drugs, the more income you earn, the better you got promoted. So this is something we can see the structure. I'm going to quickly go over and then understand the inside. This is the part, the table I want to. I was trying to present something about what to do with that. We know everyone's incentive is to sell a prescription or to get antibiotics. What to do it? So it turns out there's, if this is the producers, if you look at the trajectories, that part is the patient. So which way we probably able to stop it, to have something is a workable solution. Otherwise, if we talk about system approach, but where to get it started? And turns out, you look at this one, health facility and health facility is the patient. So you have to start from the patient education. Luckily, China's internet education, will have lots of, the years of schooling has increased. So you can use lots of, social media, other things to do health education here. And then you work on the 70% of health facility, even they are producer directly health facility or producer to distributor or whatever, the second layer is here. So if we can work on this relationship, that's 60%. And retailers will have the policy, but it's the enforcement. So that's 30% is increasing. So if we work with the retailer with patient and retailer with patient, that might be something you can, using the information they sold, and then to check how many prescription they got. So this is what I got myself on the National Big Health Data Panel. So this is something I'm going to push for using, because they're all in the information out there. And you can just rank them and check them. So change the behavior of retailers to patient. Then the last one is the internet shopping. It's increasing. I'm also trying to talk to Alibaba and Tencent next week to see whether or not I can have that part controlled. I don't think I have the capacity, but I'm trying to get myself into So now I'm not a national the health data expert in that one. It's just happened, you know. I have to try very hard to get myself on that pedal. Otherwise, you won't be able to enforce it. So I think if by looking for a solvable solution, instead of putting a, you know, Jerry, I had lots of problem in putting this into a system approach, because system approach, you end up don't know where to break it because it's changing behavior. So this is the approach we think about. If we can break up all those incentives, or then we can put more enforcement. Anyway, we'll talk more about this one. Hopefully, you'll give us some recommendation, because Xiaoyun wants to produce a paper based on this the channels or pathways between the producer to the user. In that way, that might work. So I think it's kind of a intervention targeting patients, intervention targeting health facility. Actually, health facility will be doctors and hospitals, or intervention targeting retail pharmacies and online purchasing. Those are the few specific policies we want to see, especially those are all on information database. We have, you know, it's amazing to see how information, all those databases created, but not knowing how to use it. So next time is how to use the massive data to do it. So that's my talk. Okay. Thank you.